So the flu is more prevalent during the winter months because the virus actually lives longer indoors. The reason is because it's more humid outside, so it can last indoors longer. And one of the reasons that we get more unwell in the winter is because we personally spend more time indoors also. So there's more chance of us being around the virus and around close contact with someone that potentially has the virus, and we spread it a lot easier during the winter months. So some of the ways that you can protect yourself from catching the flu are the basic things, for example, washing your hands regularly and doing so with soap and water. You should also prevent yourself from touching your face, your eyes, your nose and your mouth, having not washed your hands first. The other thing is to avoid sick people. So avoid people who have the symptoms of the flu, and most importantly, stay home if you are unwell. So if you're suffering from cold symptoms or flu symptoms, the way to get better quickly is to rest and sleep, to keep warm, to drink plenty of fluids, and you can take ibuprofen or paracetamol if it's appropriate for you to manage the fever and any associated aches and pains. The difference between the cold and flu is with the cold you experience milder symptoms. Some of the symptoms that I'm talking about are a sore throat, which you would have for a couple of days, along with a runny nose, so nasal symptoms. That would also include congestion and a cough, which would maybe present around the 4th or the 5th day. Fever is uncommon in the cold, however it's more common in the flu. You may have watery or nasal secretions also in the first couple of days of the cold, which may thicken or get darker as the cold progresses. Cold is usually up to a week and it's much milder symptoms than the flu. The flu symptoms are extremely similar to the cold, except you'll have a quicker onset of the symptoms. You'll experience more muscle pain, more fever, headache, muscle aches and pains, soreness, and you may even experience, not as common, but you may experience a shortness of breath. The main difference between the flu and the coronavirus is that the coronavirus is a more gradual onset of symptoms. With the flu, you experience these a lot quicker. The other things you need to watch for that maybe distinguish coronavirus from the flu is that you'll have a shortness of breath, which is more common in coronavirus, and you will also have a loss of taste and smell accompanied with a high temperature.